Through a collaboration with the Pan-American Health Organization, PAHOWHO, the two-day training, which commenced on Friday, is expected to pave the way for improved access for youths to sexual and reproductive health services, which has been heavily impacted by the COVID-19 pandemic.
The pandemic has intensified and magnified inequalities in the vulnerable groups in accessing SRH services. And in accessing the SRH services, we kind of saw the need for us to be able to try to bridge the gap by producing and delivering services.
That was Executive Director of the organization, Arlene Chituria. Founded in 1973, the Guyana Responsible Parenthood Association, GRPA, is a non-governmental organization dedicated to the positive sexual health for all citizens in Guyana. Through awareness, education, and health services based in a confidential and friendly environment, the association promotes individual choice, family planning, and quality sexual and reproductive health services. It is expected that once they complete training, the youths will aid the organization in the countrywide deliverance of its services. The advocates will also assist GRPA to promote and deliver sexual and reproductive health information and services, including HIV and STI testing and screening, contraceptives to women, youth, and other vulnerable groups in communities across Guyana.
Our core services are in Region 4, but we collaborate with other organizations provide STI screenings, HIV testing services across the country.
The current training session targets youth from regions 1 to 7. However, another session will be hosted on September 11 for youths from regions 8, 9, and 10. This training session will be facilitated in Linden. According to Chituria, each youth is selected based on their individual interest in the program. It is expected that a number of follow-up education and capacity-building sessions for youth will be held in the near future to ensure that they fully participate in advocacy and the COVID-19 response. Further, the association will also present its final report of a qualitative assessment and access to sexual reproductive health services by vulnerable groups during the COVID-19 pandemic in Guyana to the Ministry of Health. For the HGP 90 News, Kendell Richmond.